Healthcare professionals like physicians, nurses, technicians, and pharmacists must work collaboratively to ensure that patient care is safe. While the care these professionals give requires collaboration and teamwork, they seldom are trained together. Instead, they are educated and trained in their separate disciplines and then are forced to work together as a team, often lacking the knowledge of effective collaborative teamwork. When healthcare teams are not functioning well, it increases the risk of medical errors that can cause significant patient harm. Medical errors affect millions of patients each year. In fact, 1 in 17 hospital stays in Canada result in at least one harmful event, most of which are preventable. Collaboration and teamwork are crucial to patient safety. When teams function at their peak capacity, they make fewer mistakes. When team members are committed to cooperate, coordinate, and communicate, they achieve optimal patient outcomes. However, merely putting a team structure in place does not ensure the team will function well. Teams must learn how to work together and be willing to sustain those efforts across different situations and over time. One of the most effective ways to do this is by implementing team training interventions programs. These programs focus on the factors essential to team functioning, like leadership, communication, professional structures, and team support. When successfully implemented, these programs improve team collaboration and team performance, but most importantly, patient safety. There are several healthcare team education and training programs used in North America that effectively improve team collaboration and patient safety, and we'll discuss some of those next. The Team Strategies and Tools to Enhance Performance and Patient Safety Program, or Team STEPS, is an evidence-based curriculum proven to improve collaboration and teamwork within dynamic healthcare teams and promotion of patient safety and safe work environments, which optimizes patient outcomes. This program offers education and training through a mix of learning modules, videos, scenarios, case studies, simulation exercises, and workshops. An important aspect of Team STEPS is that the curriculum is highly adaptable so it can be tailored to the needs of each individual organization. Let's discuss Team STEPS in a little more detail. The main emphasis of Team STEPS is on defining team skills, demonstrating strategies to build proficiency in the program's core competencies, as well as strategies to overcome barriers. As you can see from this diagram, safe, efficient, and patient-centered teams are the program's goal. Then there are 4 core competencies used to achieve this goal. The first competency is communication. This is the sharing of information between team members. Strategies for effective communication include SBAR for critical information, checkbacks to confirm information is understood, and handoffs when patient information and patient care are being transferred to other team members. The next competency is team leadership. This is the communication, coordination, and collaboration of team members. Strategies for team leadership include briefs, which are quick planning sessions to assign roles and responsibilities and to establish expectations for the coming shift. Huddles, which are ad hoc meetings to assess the need to adjust the plan or to reinforce the current plan. And debriefs, which are quick discussions to improve team performance through reflection and to reinforce effective behaviors. The next competency is situation monitoring. This is a process that cultivates a shared mental model to ensure that each member is on the same page. Strategies for situation monitoring include the I'm Safe checklist, which is used to determine the team member's ability to perform safely, and cross-monitoring, a harm reduction strategy involving monitoring the actions and stress levels of team members, catching mistakes early, and being a safety net for team members. The last competency is mutual support. This is helping team members with their workload, providing feedback on performance, and advocating for patient safety. Strategies for mutual support include being willing to seek help and offer assistance when you're able, providing feedback that is appreciative, timely, respectful, specific, considerate, improvement-focused, and patient-focused, and advocating assertively when patient safety is at risk. Encircling the 4 competencies are the team-related outcomes of knowledge, attitudes, sustainability, and performance. You can see how that purple bleeds down through the puzzle pieces into the program's goals. This represents the dynamic interactions between outcomes and competencies that produce safe, efficient, and patient-centered teams who then deliver safe, quality care. So, what does the research tell us about the effectiveness of Team Steps? Well, the Texas Health Resources Women's Services implemented Team Steps as a pilot project and reported the program led to measurable improvements in team collaboration, communication, and patient satisfaction, and has also reduced patient harms. The program worked so well that they expanded it to all service areas. And there are numerous studies and systematic reviews which report overall that the Team Steps curriculum enhances interprofessional education and collaboration, improves the culture of safety in organization, and improves patient safety and satisfaction. And where refresher courses were offered, the overall improvements were sustained at 1 year post-implementation and beyond. Most importantly, healthcare providers reported that the program helped them gain a sense of value for improved collaboration and how it relates to patient safety outcomes, and that they even enjoyed the training. This tells us that Team Steps has a direct positive impact on interprofessional collaboration by improving teamwork processes. So, by functioning better as a team, medical errors are then reduced and patient safety outcomes are increased. Sounds like a success story. Let's take a look at another team building intervention.